nation's commercial capital. This is the news at 10, live from Channels Television. Reported tonight,
Bimbo Oloede.
Hello and welcome. Tonight, Nigeria records first death from Ebola virus. Federal government requests for trial drug ZMapp from the United States to tackle disease. Governors of Nigeria's southwest states brainstorm on ways to contain spread of Ebola virus, appeal to striking doctors to go back to work. INEC chairman reels out guidelines for Saturday's governorship election in Osun State. And security tops discussions on day 2 of the US-Africa summit as businesses commit to investing over $50 billion to fix continent's infrastructure.
And on business news tonight, Nigeria Electricity Regulatory Commission concludes plan on electricity tariff review.
And on sports news tonight, Nigeria's female under-20 team, the Falconets, begin their campaign at the FIFA World Cup with a game against Mexico.
I'm Linda Kibu, and from Abuja, key Boko Haram suspect narrates his role in the operations of the terrorist group.
We begin tonight in the nation's capital, where the federal government has announced that it has reached out to the United States Center for Disease Control to request for the unapproved Ebola drug ZMapp for the treatment of affected persons in Nigeria. This is coming as the Ministry of Health announced earlier today that one of the nurses who attended to the Liberian victim of Ebola in Lagos has also died from the disease. The Minister of Information, Labaran Maku, and the Minister of Health, Onyebuchi Chukwu, who briefed State House correspondents at the end of the Federal Executive Council, presided over by Vice President Nnamdi Sambo, said government was awaiting the response of the request it made last night to the center in the U.S.
According to the World Health Organization, the Ebola virus disease has so far claimed about 900 people in West Africa, representing 60% of the virus in the world. The disease was a major talking point at the Federal Executive Council meeting. Briefing State House correspondents after the meeting, the Minister of Health, Professor Onyebuchi Chukwu, warned that Ebola is a national emergency with everyone in the world at risk.
As at this morning, Nigeria has recorded 7 confirmed cases of Ebola virus disease. As at this morning. You will recall that the first one was the index case, the imported case from Liberia, of which the victim is now late. And yesterday, the 5th of August 2014, the first known Nigerian to die of this disease was recorded. And this was one of the nurses that had attended to the Liberian. The other 5 cases that are Ebola positive are currently being treated at the isolation ward in Lagos.
The Health Minister, who said Council focused mainly on the measures being taken to check the Ebola virus, said the federal government has reached out to the United States Center for Disease Control to request for the unapproved Ebola drug ZMapp for the treatment of affected persons in Nigeria.
I just want to say, believe you me, we are doing everything possible. This morning, I sent an email to the director of the U.S. Center for Disease Control, because even in the last, we have been in communication in the last 36 hours, either talking or sending emails. We are communicating by emails as well as talking. And I also asked, I said, we are getting reports that the experimental drug seems to be useful. Is it also possible that we can have access for our own people who are presently being treated under incubation?
The Minister of Information advised Nigerians to be wary of quacks who would want to take advantage of victims.
We had the story that bitter cola could cure Ebola virus disease. Now, that has not been verified.
The Minister of Information said the federal government is also set to recruit and deploy health personnel with attractive remuneration to Lagos to assist in the fight against the deadly virus.
With the current challenges in combating the outbreak of the Ebola virus, the Medical Association of Nigeria has been asked to consider calling off its strike action to join in the fight. The new call is a part of the outcome of the meeting hosted by Governor Babatunde Fashola, who is leading a joint advocacy and collaboration among his Southwest colleagues in the fight against the Ebola virus. The forum also wants the federal government to step up surveillance on several illegal borders scattered across the country.
If some of these governors seated here were in Osun State for this briefing, then it may not be difficult concluding on what they may want to say. But they've all taken a break from their political persuasions and pursuits to meet here in Lagos and jointly tell the country their concerns about Ebola virus, which has claimed its first Nigerian victim. This new collaboration wants to tackle the management of Ebola from 4 angles: the illegal borders, collaboration with the federal government, advocacy, and all need for members of the Nigerian Medical Association to lend a helping hand.
While we are calling on the federal government to assist us, really, we need men and material to man those borders. As we speak, we have about 68 or so healers vehicles manning all of those borders. And not just vehicle alone, you will need the appropriate manpower, the immigration, the customs. Even our medics, they have to be there. And that's why I've been shouting, saying that we need help if we are going to succeed in the prevention of this spread of this Ebola virus.
Enemy will do well to exercise that aspect of their training as doctors, that Hippocratic oath that they sworn to in order to help arrest this emergency that we're dealing with.
We sought to know from the governor if the death of the nurse who attended to Mr. Sawyer is indicative of the challenge in managing the solution. Here is what he said.
It's being done because from that first report, we now have a record of all the people that we can confirm that Mr. Sawyer may have contacted or who may have touched him from the airport right through the hospital, and we're following through with all of those people. That is a lot of work being done because we got a report and we keep tracking. And anybody who shows that symptoms, again, we must now monitor who he has been in contact with. Going forward, we have set up an isolation ward in Yaba. And with that isolation ward, people who are attending to patients there are under strict protocols, wearing protective equipment, working with the team from Center for Disease Control about how this process should be contained and managed.
Rather than panic, the message from this forum is that it is time to pay attention to understanding containment strategies. Governor Fashola is also of the opinion that certain practices must now be reviewed, which could help bring this episode to a wrap. Olu Phillips, Channels Television News.
In the meantime, the Director General of the National Agency for the Control of AIDS, NACA, Professor John Idoko, says he's optimistic that the dreaded Ebola virus disease will soon be a thing of the past. The NACA boss told journalists in Abuja that Ebola will fade away just as other epidemics. He adds that what should be more worrisome is maintaining a sustainable control measure of the HIV infection, which has consistently spread globally in the last 30 years.
There are 2 diseases here. One of them has been with us for over 30 years. And we still don't have a cure, we don't have a vaccine. We've been working very hard. But we now know that if we discuss post-2015, we can still continue. Ebola is an acute zoonotic disease, you know, and it is not transmitted by us. We are going to see many more epidemics like that. We've seen in the last 30 years, we have seen epidemics of meningitis, we've seen epidemics of cholera. So you cannot compare it with something that is on a chronic basis. It enters your system and it's there, and we don't have a cure. So I am positive that given all that the government is doing and the awareness that we have in this country, in a matter of months, Ebola will be a thing of the past.
In part two, after the break, ahead of Saturday's governorship election in Osun State, INEC chairman charges political parties on proper conduct during the poll. That's in a moment. Do stay with us.